My name is Beth Landon. I'm the Director of Policy and Communications at the New Mexico Hospital Association in Albuquerque. My boss would tell you that I'm the Director of Other Duties as assigned. We are a small team in New Mexico, so I'm certainly involved in policy, strategic planning, and really member engagement in listening to our member hospitals and gaining their ideas for how to transform the care they're delivering. Policy absolutely has a direct impact on the patient experience. Changing in regulations, changing in legislation, and looking at new ways to deliver care, developing care guidelines, for example. We've done a lot with opioids, and we're doing a lot more. A variety of areas, behavioral health, looking at the rural hospitals and the rural patients and geographic barriers to care. Obviously, Medicaid expansion, we're an expansion state. Improving access to that insurance is improving access to appropriate care delivery. Right here at HIMSS, so I'll tell you about our work with Collective Medical Technology. This is a collaboration with the Medicaid managed care organizations, the payers. We've come together to change how care is delivered in the emergency department and after the emergency department. And it really is about the patient experience. So Collective Medical offers a two-pronged solution. It enables ideally informed care from the emergency department because information is pushed to the clinicians to give them information about the patient they're caring for. And instead of feeling like a TSA agent, they can say, "Good afternoon, Beth. It looks like you've been seen several times in the last few months for headaches. I don't want to do more brain imaging. Let's talk about what's happening and what has worked for you so far and take you and get you somewhere else." Concurrently, in the same milliseconds, information about that emergency department visit is pushed to the payer and to the primary care physician if they're connected to the system, so that they know that visit has occurred and what happened in that visit, so that they can work proactively in coordinating care for that patient. So it's really about changing the way the patient experiences care and the quality of the services they receive. Something to understand about New Mexico is that 40% of our population is on Medicaid. So we can ill afford siloed solutions, and we have an awkward opportunity to transform patient care. And I say awkward because poverty is not a strength. But because it's a percentage of population on Medicaid, we can work with 850,000 people, or think about 850,000 people out of 2.1 billion people differently. And that is the opportunity. There's a lot of rhetoric nationally around ED utilization and reducing ED utilization. Well, in New Mexico, emergency departments are often the point of care. There aren't other First of all, there aren't enough primary care physicians. We suffer a dearth of primary care clinicians, and we have the highest proportion of primary care docs over the age of 60. So we are very eager to improve that pipeline of primary care clinicians. Second, many of our towns are too small to support urgent care. That leaves the emergency department as the place to go. So we're saying, how can we change how the emergency department functions, since that is where people are coming to? How can the emergency department be more effective in supporting the patients, whether they're on Medicaid or anything else? And as a mother who lives in Albuquerque, I can tell you the hours that pediatric urgent care are open, and we end up in the emergency department as well. And that is the reality. So when we have 850,000 people on Medicaid and 37 non-federal emergency departments, it makes a lot more sense to focus on changing the care delivery than trying to educate the patients to go somewhere else, as if there is somewhere else for them to go. I think what impacts me is the patients. And whether it be family members, friends, seeing their experience, hearing their experience, the good ones and the not so good ones. Our healthcare system is incredibly fragmented. It's incredibly complicated. I have 2 master's degrees and I work for the Hospital Association. I can't understand a patient bill. How do we expect anyone else to? And how do we expect people to find their way through the system? And as I have friends, family, and talk to patients about their experience, it reminds me why I'm doing what I'm doing and what done looks like. Done is a very positive, smooth patient experience. And I don't think there are perfect models anywhere on earth. So looking to another system in another country, I don't think is the solution. But how do we harness the amazing technology available today and the passion of providers? Let's remember that clinicians suffer all of that academic slog because they care. And as long as the system doesn't burn them out, there is an opportunity to energize, engage them, and enable them to do their jobs. I would love to see a world where patients don't sit 2 hours to be seen for a scheduled appointment, where they don't have to fill out the same forms 10 times and then wonder if it was correct, read correctly. I have horrible handwriting. How can anybody read it? And that we use technology thoughtfully to make it a more seamless and positive patient experience and a provider experience. And I think there's a lot of conversation, rightfully, about the patient experience, and I care deeply about it. What we have to remember is there's a provider experience as well. And a lot of people leave clinical work because they don't get to do the care that they went to school to do and what motivates them to come to work in the morning. So we need to look at it from both of those perspectives. And how do we make all the regulatory, administrative, bureaucratic systems smooth that out? Thank you.